Okay.
Perfect.
Hey, everybody. Welcome to the Well Man's Podcast. I'm really excited today. Brian and I have another very special physical therapist that's on with us. Her name is Fahir Pathan. A couple of weeks ago, we actually had the pleasure of having her husband on, Fahir Pathan. And Fahir is very specialized because she deals, she's considered a woman's health expert, but definitely deals with an expertise in pelvic floor dysfunction. And this is something that I've ran across a lot in my clinic. Fahir was educated at the Government Spine Institute in Ahmedabad, India.
Ahmedabad.
Okay, thank you. But also did her post-professional degree in physical therapy at St. Augustine, Florida. Currently, she has a mobile practice, her and her husband, and they're local to the Triad area. So this is why I love them, because I'm also in the Triad area. And I just found out about them just a few months ago. So really excited to get them on and have people use their services, because I just haven't heard of many physical therapists doing that and having a mobile practice. So it's really great to have somebody come to your home. So anyway, we're really excited to have you on, Fahir. Is there anything that I should mention?
Yeah, no, I think you did pretty good. Thank you so much. Thank you for having me.
Yeah, we're thrilled.
Yes.
So I guess the question that a lot of people probably want to understand is really what is pelvic floor physical therapy? What do you mean by that? And what are the conditions that go with that?
Yeah, so usually, pelvic floor therapist specializes in treating pelvic floor muscle. This is a muscle under your pelvis, from tailbone in the back to the pubic bone in the front. And it supports the three main organs in women: bladder, uterus, and rectum. And in men, of course, bladder and rectum. And, any dysfunction in this muscle can lead to leakage of urine, constipation, and pain in that area. So a pelvic floor therapist usually helps in the function of peeing, poop, and sexual intercourse.
Oh, okay. What about like prolapse and stuff, like organ prolapse?
Yes, organ prolapse also comes under pelvic floor dysfunctions. And usually when the muscles and the tissue around it, around these organs are weak, your organs fall out, which is called as a pelvic organ prolapse.
Right.
And, and depending on the level of prolapse, if it's not to third grade and if it doesn't need surgery, PT can help you strengthen your muscles around it and help you train, so you can reverse the condition so many times.
Yeah, I think a lot of people, are not really that aware of these muscles and what they do.
Oh yeah, sometimes I've seen that, even though people have heard about Kegels, and when I see my patients, they've not been doing the same muscles. They're not activating same muscles. Something we call is co-contraction. They are either doing using like the adductor muscles, like squeezing their knees or squeezing their butt along with it, and not actually doing the Kegels exercise that they're supposed to do. And so, usually when we do internal examination, that gives them the better idea that this is what the exercise that they're supposed to do. This is the muscle that they're supposed to contract.
Can you explain what Kegels are? Because I know that's a really important exercise to do. I'm aware of that, but what do you mean by Kegels?
Sure. So before Kegels is an exercise where you activate your pelvic floor muscles. What we call is, like, say, for example, the cues that we'll say is like, try to close the back passage, or try to close the passages that are underneath in the pelvic region, underneath in the vulvar region. And what you're going to feel is, as you are lifting that muscle, you will feel that a sensation of lifting. But the important thing that I want to mention is Kegels is not the solution to everybody's problems. Sometimes if you're doing Kegels and it's increasing your concern, you probably have a tight pelvic floor muscle and you do not need to do Kegels at that time. So pelvic floor muscle is the dysfunction is mainly either hypotonic or hypertonic. So hypotonic means it's very weak and hypertonic means it's really tight. So if you're doing Kegels and it's a tight muscle, it's very minimal range that you're contracting. It's not gonna help your condition. It's gonna make it worse. So you want to get it evaluated first to see if it's a hypertonic muscle or a hypotonic muscle, and then based on that you will get your treatment. So just learning about it that okay, if I do Kegels it's going to help me and it's going to solve my problem is not true.
Right. So how do you determine whether it's hypertonic or hypotonic?
So, when you come to a pelvic floor therapist, what we do is we do an internal evaluation, which is inserting like finger through vagina in women and through rectum in male. Yeah. And that will give us the idea of if your muscle is, if there are any tender spots in it. Then we do a manual muscle testing, which gives us the idea how much strength and endurance of that muscle is. Then we check the breathing pattern and then see the relation of what your muscle is doing when you're breathing in and when you're breathing out. Also, by looking at the anatomy, also you can see if that muscle is really clenched and tight. And right. So in that situation, we first go and do certain exercises, some manual therapy to release those muscles and to relax them completely, to bring the full range. And then we go for strengthening. So so that will be an internal evaluation. Of course, it includes like external evaluation by your therapist too, where we will see the posture and, external strength of the muscles around it.
Right.
How are you grading?
Go ahead.
Yeah. How are you grading the strength with the MMT or the manual muscle test when you're in there?
So there are different tests that you can use. And, there is Laycock and so basically the strength, I have done the course from Harman and Wallace, and that was a great test. I'm trying to think about its name, but it's not coming in my mind right now. But the way it is graded is, the grade 1 is when you can just feel the flicker of the muscle. And the grade 2 is when, only a slight flicker, but it's not coming from interior wall or posterior wall. Or it's just coming from one of the wall or one or two of the wall. You can't feel it like symmetrical contraction from all the walls of vagina. Okay. And the third is that you might feel again it might not be coming from all, but there might be some slight movement that you feel going upwards. And then the fourth is you feel it from all the walls, and there's some slight upward movement of the finger. And the fifth is like you feel complete strong contraction from all the walls, and there's like good upward movement of the finger.
That's what you want, right? You want that. No.
And that's what we want, yeah. And of course, like at that time, we also make sure that the surrounding muscles are not contracting, like adductors, or you're not squeezing your glute, or you're not doing abdominal contraction.
Okay.
Yeah.
So some of the symptoms I ran across with my men and women. For my men, I get a lot of like prostate issues, or like where the men feel like they're sitting on a golf ball or something and have a lot of pain there. Is that a pelvic floor issue?
It is. Now I treat women's usually, but yes, it is a pelvic floor issue. And I've learned a lot about it, and yes, that helps men tremendously. Like a pelvic floor therapist who treats men can help them for sure.
Right. Yeah. And then in women, this is like really frightened one of my patients, where she sat down to pee, and basically when she sat down to pee, her vagina like completely prolapsed.
Yeah.
That's a weakness, right? Of the pelvic
muscle. Of the pelvic floor muscle and the tissue around it. Yes.
Yeah.
Yeah.
Wow.
And probably, go ahead, Brian.
When is it time to basically seek your help? At what point is it just the pain, or I know after pregnancy and after delivery, people should often see a pelvic floor therapist. Is there
Yeah.
another time or things that people know that, this is happening, I should seek these services?
Sure. So, if they pee on themselves laughing, running, or working out, or maybe coughing, sneezing, that's when they should seek out pelvic floor therapist. Other than that, if you are going too often to the bathroom, say for example, normal amount of time that people should go to the bathroom is 6 to 7 times in a day in a 24-hour period. Also, obviously varies depending on how much water you drink, but that's the normal number. And if you're going too often and you do not have to pee for at least 7 seconds, and you're concerned about it, that's something you should talk to your healthcare provider or seek out help from pelvic floor therapist. Pain in the pelvic region, or pain in the low back, also after pregnancy, upper back pain in the pregnancy is usually I commonly see. Again, like you said, pelvic organ prolapse, when you feel that there's something, you feel heavy in your vagina, or when you have to push it in after you go for bowel movement, that is suggestive of that you might be having organ prolapse, and a pelvic floor therapist can do the test and determine that.
Other than delivery, is there a specific surgery or a surgery or other medical intervention that you commonly should see a pelvic floor therapist after?
Yeah, even after pelvic surgeries, like in the male and female, the surgeries like your uterectomy that they do, that is like a lot of pelvic floor dysfunction that can happen after that. So that would be even for every postpartum women, they should come see the pelvic floor therapist, at least once. And yes, after the surgeries too, I would recommend that the patients come and get it, evaluated, especially if they have something going on, like they feel it's not normal for them. They should come and be seen by a pelvic floor therapist.
Okay, great.
And I think I missed out on urge incontinence too, which is very common. Yeah, when you have this is like you have urge to go to the bathroom, and before you reach the bathroom, you pee on yourself. That's also a condition where, like, your the trusor muscle, the muscle of the bladder, is very overactive, and pelvic floor therapist can help you in that too by doing bladder training and a lot of therapeutic exercises.
Yeah, I see that a lot in older men and women, a lot, where they cough, laugh, or sneeze and lose a little bit of urine.
Yeah. So it's very common, we were going to discuss about the myths too. And so, people just accept it because they think that just because they age, they're going to have that weakness, and it's common, and they accept it in their lifestyle, but it's common, but it's not normal. And there is a solution to that problem. They need to seek out the help for it, and they can see a good pelvic floor therapist who can help them.
Yeah, and not jump right to surgery or whatever, or anything like that.
Yeah.
I see that a lot. I see like a lot of the pelvic floor dysfunction. Well, I don't think a lot of medical doctors realize that it actually is pelvic floor dysfunction, and that there's a non-invasive, relative to them, a non-invasive treatment for it.
That is absolutely. Yeah, and patients are not being referred to pelvic floor therapists, which they should be.
Right.
Yeah, it's very under the radar. If you're not educated on it, or you don't know pelvic floor therapists, you rarely hear about it.
That's true.
Yeah. But treatment does consist. I mean, so it's relatively non-invasive, where you're not doing a surgical procedure, but you are going into the internal cavities. You're going into the vagina. You may be going into the rectum on men to manipulate the tissues or whatever, give them treatment, right?
Yes. Yeah, definitely. A pelvic floor therapist will do an internal evaluation to treat you.
but it's not only the evaluation, right? I mean, a treatment also.
Yeah, for the treatment too. Like we do a lot of manual therapy if there's no, tender spots in it, and we palpate the muscles from inside. Like there is this muscle obturator internus that you can palpate from inside. So basically, so many patients who have back pain, sometimes, they see the therapist, like physical therapist too, and they don't relieve their back pain. But sometimes that muscle has never been internally treated. And that has been just treated from outside and not an internal evaluation, which a pelvic floor therapist can do and treat you from inside and outside.
And you wouldn't be able to tell where that back pain's coming from without that internal evaluation, right? Yes. So me as an acupuncturist, like I always say, it looks like it's some type of muscle related thing. I'm going to treat you 1 to 3 treatments. After that, you should get better. If not, I have to refer out. It sounds like that you or your husband or a physical therapist would be a good referral to go right to get
sure. Yeah.
It's fascinating because I think you could prevent a lot of these, in the lingo, I hear sling surgeries. It sounds like they like for bladder and stuff, like they're going in there and it sounds like a sling they're putting in internally. I don't know much about it, and they're holding up.
For prolapse, for prolapse they usually use pessaries. This is like a soft, flexible device that they place inside through the vagina, or for male, I think through the rectum, and they support those structures that are falling out. And sometimes they would do they would do an incision in the vaginal canal, and then they will support that structure through the sling or through a graft, and that will help it support it. And this is usually I think every patient who has this should come to see a therapist, pelvic floor therapist, get the treatment, and if they do not improve with it, they can go for the surgery. But usually people just go for the surgery and then they realize that they probably had that solution.
Yeah, no, that solution, the surgery, can cause a lot of other problems. But even if you get the surgery, wouldn't seeing a PT person, pelvic floor expert, help also? I mean, even after you got the surgery, okay.
Yeah, sure. Yeah. Because sometimes, these surgeries can create a lot of tension in that tissue and pain and swelling. And so definitely they should get a PT, pelvic floor PT, even after the surgeries.
Yeah. Well, I think you look at it in the same way of like a total knee replacement, where after the total knee replacement, they basically rip through so many tissues. One of the most important things is to get the quadriceps muscle to fire. So it'd be fairly similar to that. So if they start ripping through those tissues, now you need to reorganize the situation, get everything to fire properly, which should help you with.
Yeah. Getting that range back, getting it to work the way it was working. Yeah.
Mm-hmm.
Are there any contraindications to, like, if you're getting treatment? I'm thinking like maybe you're getting treatment and you work out a lot, and maybe if you're doing like a squat or a lunge or something, you're creating a lot of internal pressure internally. I would think that would kind of inhibit treatment a little bit. Am I correct in saying that?
So
it's like if you're straining internally, like maybe if you're going to have a bowel movement or something and you're pushing that, wouldn't that, especially if you have prolapse, it seems like that could make it worse. And
so usually, when we treat, we do go through not only just like muscle strength, but we also go through like good toilet habits. And one of that would be main important for the constipation, or just in general any incontinence that you're going to, that do not push.
Right.
Training is not good because it puts a lot of pressure on your pelvic floor muscle.
Right.
And like you said, even in the prolapse too, yes, you will have to learn what is your limit if you feel that it's like putting a lot of pressure and you're having the symptoms. You want to back out of it at that time, because you want to make sure it's first strengthened. It's not coming when you're doing it. So yes, it is something that, when we treat our patients, we educate them a lot, because education does most of the work. When they know about the condition, and our goal is to get to the point where they can self-manage their condition. So that would be something we would go through, like the activities that they're doing, and like when I was talking about like the toilet habits too, some people who have urge incontinence too, they have, most of them have this habit of like going just in case.
Yeah.
So, let's just go just in case. If I need to go to the bathroom, I'll just go right now.
Right.
But what happens is your bladder is like an elastic organ. And if you keep on, going when it's just filled to this level, and you keep on going, it's just going to lose its capacity to expand. And it's going to have a small capacity then. And then when it gets to that level, you will have the urge that you probably need to go to the bathroom. While normally your bladder has the capacity to fill to 400 to 600 ml of urine. So when it gets to a 300 ml, that's when you should feel that that's the normal urge in humans. And if you're not listening to your body, if you're not listening that this is the time that I need to go, and either you go before that, like just in case, or you just don't care about it, and then you don't go, then it expands. So you have to listen to your body, and if you feel the urge, you should go, but you don't make a habit of just going every 1 hour or every 2 hours,
Right.
Yeah.
Yeah. So I would think, I mean, if you're struggling with constipation a lot, like there may be other treatments that you may need to do in addition to pelvic floor therapy, especially if you're prone to prolapse or whatever. And I'm just thinking, off the top of my head, like, the basics, like make sure your diet's good, make sure you're drinking plenty of water, make sure you're exercising, maybe some magnesium. Yeah. Magnesium, our number one recommendation.
And also, like, breathing is like holding or straining is not good. So, breathing, when you deep breathe and relax your pelvic floor, constipation happens usually when your pelvic floor do not relax completely.
Yeah.
So you have a tendency to hold it.
Right.
Keep it tight. So that's something that we work on, is relaxing those muscles. And we use biofeedback technique, which can be either meter or, we have biofeedback devices that we use. And that gives, basically it's like controlling your functions. It gives you a feedback that your muscle is tight and you need to still relax it.
Right.
So when the biofeedback device, you place the electrodes and that region, and it gives the electrical activity from that muscle. And if you would if it's connected to the computer screen, you will see that that graph is up, you're not able to relax it, and by looking at it they will learn, okay, it's still up and I need to get it down. And so those are the techniques that we use for them to learn to relax.
Right.
Also like some yoga stretches and some like happy baby pose. And the same thing they have to apply when they go to the bathroom is like learn to relax, and then it will be easier, and then they won't be straining and create getting to the point where they will have organ prolapse.
Right.
Yeah.
Fahir, what about sexual function? Because I know with some men and women, like by strengthening the pelvic muscles, will that enhance like orgasm, sexual pleasure, that type of thing? Can it? Have you run across that with people? I've run across it in my clinic where some people have real issue with that.
Yes. And so usually if they have pain with intercourse, there is some tender spots in the pelvic floor muscle or around, like in the adductor muscle, that might be some tender points. And, again, the same thing, we will, when we train on, treat those muscles through manual therapy and train them on relaxing those muscles, that can help. And even if they have weakness and they're not having the sexual pleasure, the strengthening those muscles, like I have had so many patients when they come for incontinence, and I've worked with them for strengthening, and then they come and tell me, like, my husband says, like, he's like, it has changed a lot, and like I got a feedback from him that he's having fun now because
Yeah.
I have more tight and like, you know, toned muscles.
Right,
So
right.
it does definitely makes a whole lot of difference in your sexual life too.
Yeah, so it could enhance that for men and women.
For men and women, absolutely, yes.
Yeah, that's great. The other question that I find fascinating, I don't know if you have experience with this, but I just before our talk, searching online, there's all kinds of devices online, like of weights you can insert into the vagina to hold or squeeze.
Mm-hmm.
Equipment. There's one person on Instagram, she who talks about, you could see them holding on to like she has something inserted in her vagina, and she's holding, and it's strapped to a weight that she's dangling between her legs to tonify her pelvic floor muscle. Does that work? Is there something to that?
I mean, that was very much used in before. You can use it, but you know, yes, those are like strengthening different kinds of devices that you can use. But again, the same thing. You would want to get it checked what it is before you want to go.
Before you do that.
Yes.
Because you could possibly make things worse depending on what's going on.
Yes, absolutely. Yeah.
Well, it's okay. The other thing is, so as far as men, I know this is you're a woman's health expert primarily, but also can help men. But I see a lot of men after like prostate surgery or just older with the incontinence, can't get an erection, or you know, sexual pleasure is slim to none. It sounds like this could help them with all of the above too, right?
Yeah, absolutely. Yes, it can. Yeah. And nowadays, I think a lot of men students and men therapists are also getting in this to help other men. And a lot of women pelvic floor therapists are also treating men, and they have seen a lot of positive changes with it, because you know, the anatomy is pelvic floor anatomy is similar in both men and women.
Right,
and
right.
So, yeah, definitely, yeah.
That's great. I'm thrilled you and your husband are in town or in the Triad area here. So it's really cool. Anything else that we should talk about or go over?
I've got another one. I've got a question for you, Fahir. As far as you talked about like toilet habits and things like that, are there good habits or just tips that you've seen in your experience that the general population should know about when it comes to their pelvic floor health?
Yes. So, you know, one thing would be like, do not strain. Other thing would be, do not use your cell phones, or don't be distracted when you're going to the bathroom. Because
that's a good one.
Yeah, you want to focus on what your body is doing, you know, because your brain, if it's breathing, you're focusing, it helps that process. So don't be distracted would be another thing.
That's a good point. I probably haven't taken a poop without my phone since like 2004 or something like that.
That's my office. What are you talking about?
Yeah, that commonly happens everywhere, and that's something I tell my patients a lot, like, you know, don't be distracted doing it. The third thing would be, use the squatty potty, because squatty potty helps that position of the intestine such that it can.
One of the greatest inventions in the world, the squatty potty.
Squatty potty.
It's helped so many people with constipation. Yeah.
The other thing is, you know, when you go to public toilet, people hover on the toilets, and that is not a good idea, because when you hover, you're not relaxing your pelvic floor muscles. And normally when you want to go for bowel movement or peeing, you want to relax those muscles. So if you're forcing it in that hover position, it's creating a negative effect on it. And other than that, you know, people think that when they drink water, or when they drink fluid, they can include like carbonated drinks or sugar drinks, and that is not what they should do, because those are like bladder irritants. Even acidic citric fruits are bladder irritants, and that is going to create negative effect on your bladder. It's going to concentrate your urine and make it course. So,
Okay.
pure water as much as possible is something that you should drink. And there are various different articles on how much water you should drink, but I have this where I think it is National Academics of Science and Engineering suggest that 15.5 cups of fluid, which is 3.7 liters for a healthy man, and for healthy women, it should be 2.7 liters. And some of the different articles that I read were like, you divide your weight in pounds into half, and then whatever comes in is something you should drink in ounces.
Right.
So, for example, it's 160 pounds, you should drink 80 ounces of water.
Yeah.
So, drinking lots of water and good fluids is important.
Yeah, it's like a cure-all with the magnesium, the water, exercise, and stuff like that. And most people don't drink a whole lot, which is amazing.
Yes. Yeah, and when we do bladder diaries, we do something that is called bladder diaries, where we see how much water and what all they're eating and drinking during the day, and how many times they're going in the bathroom, and how much they are urinating for 3 days. And then most of the people get the idea, oh, I was thinking I was drinking enough, but then you get an idea that, oh, you're not drinking enough.
Right.
Go through that process of bladder diary. Yeah.
So with that, you'll actually measure the urine excreted?
Yes, you will measure the urine. There are different ways of it. The best way is to measure it with the measuring cup, because sometimes, so the other way is like you can count for the seconds, but sometimes, the flow of urine would be different in different people, so you want to get the best idea. So measuring the urine is something I suggest to my patients, and that gives them an exact idea of how much they are, how many times they're going, and do they need to go. If it's like 100 ml, or if it's like 80 ml, where probably they didn't need to go to the bathroom at that time and they could have waited. So that gives us a very good idea of how much they're drinking and how many times they're going. And, so that we can do the bladder training and help them reduce the amount of time they're going to the bathroom, if they're going like more than 7-10. Some of my patients, they like, when they come to me, they're going like 25 times in the bathroom. They're spending most of the day in the bathroom because they just have, this is their lifestyle, and they just accept it, like, well, that's what I was doing and I'm used to it.
Yeah. Well, that's great information that you should be excreting the 400 to 600 milliliters. And because even I drink about a gallon of water a day, and I feel like I go to the bathroom quite a bit. When you said about, I think 6 to 7 times is when you should go. And I was thinking I might be going too much. And I'm definitely one of those people who is like, oh, I'll go just in case I get to the Whole Foods and I got to pee. Yeah. And that's a perfect, just that can be just as negative as kind of that holding your bladder for a little too long.
Yeah,
both of them.
Absolutely. Like sometimes when we go to travel and we're outside, that's okay, but don't make it a habit, because then your bladder shrinks if you're going too often. That your bladder thinks that's its capacity.
Yeah. That's great.
Fahir, you mentioned the squatty potty. Could you just mention briefly why that's a good thing, and what it does?
Yeah, so in the squatty potty, your knees are a little bit higher than your hips, and you're bending forward, and you're supposed to rest your forearms on your knees, or on your thighs. And what this creates is, it creates an open position for your intestine, because if you're sitting upright, it kind of creates a kink in your intestine, and so it does not in that canal, it doesn't create the opening. So this position, squatty potty, will create a good opening of your canal, and that will easily, your bowel movements can easily come out. Your bowel can easily come out. So
yeah, so it's easier to pass your stool and all that, and you're getting back to the way, before we modernized, us as humans, the way we would use the bathroom, where we'd go into a sitting squat, which completely opens that up.
Position for
So by the way, the squatty potty is just, all you're doing is, like you said, elevating your knees up when you're sitting on the toilet, or
Yes.
wherever. So
So
it's just
it's like a small footstool that comes, and you can place your foot on it, and so that elevates your knee up higher than your hips.
right, right. And think about all the problems it can solve. Constipation for one. You're not pushing as much, so maybe you'll prevent hemorrhoids. It definitely is going to help the pelvic floor. Digestive function will be better. A simple solution to a whole lot of problems that doctors prescribe tons of medications and laxatives for when all you need is a little plastic footstool, so to speak.
Sure. Yeah. Absolutely.
So anything else we should go over?
I think we've been, I think I would want to make sure that we do discuss some of the myths, if that's okay with you.
Yes, absolutely.
Yeah, because, like we talked, that incontinence is normal after childbirth, is something people think, or as they age. But exactly, it's 13 million people in USA have incontinence, and please do not accept it as your lifestyle. It's common, but it's not normal, and you do have a solution to it. Just seek out.
Right.
Yeah. Again, like pelvic pain and pain with intercourse after vaginal delivery is considered normal. After at least for 6 weeks, yes, you will have some discomfort and pain, but if it continues, you do want to seek out help, because then pain is never normal.
Right.
Yeah. Also, some people think that a cesarean section will prevent all the dysfunction of the pelvic floor. So cesarean section is like cutting your abdomen, cutting your uterus, and it cuts the transversus abdominis muscle, which plays an important role in the core function of the body and helps pelvic floor. So it's not going to prevent the pelvic floor dysfunction. So even after cesarean section, you will have you may have incontinence and pain. And so this is very common. Like, so many people think that cesarean section will prevent it, but it won't.
Mm-hmm.
I didn't even know that they cut through the transverse abdominis. I guess I figured, but that's definitely pretty severe.
Yeah, because it's like, abdominal surgery. They cut through it. It does affect your
and they're doing that a lot too, Fahir, right? I mean, it seems like more and more people are doing cesarean when they may not necessarily need to, which is crazy.
That is true. Also, I think we already discussed this, health concerns are related to weakness. It's not always weakness in the pelvic floor. There can be tightness, and so you do want to get it checked before you are going just for Kegels. And so I think I've covered the important points.
Are there any prescription meds commonly prescribed for pelvic floor dysfunction that you know of?
There are, but it's not in our. I do not prescribe any of those medications. But yes, for incontinence, there are medications that are.
I guess for pain, you got pain meds and stuff like that. Yeah. It's not going to solve the problem, but may help with the symptoms.
Yes.
Either way, I tell my patients, if you're going to take a prescription med, get to the root cause. And it sounds like taking care of the pelvic floor is going to get to the root cause for any dysfunction related to that, instead of taking a med.
And just to be clear, you need to see a pelvic health therapist to get this level of care. You can't just walk in and see any physical therapist, correct?
Yes.
Oh, that's a good point. Yeah.
Not all the therapists are, trained to do it. So a pelvic floor therapist who knows and who can do the internal evaluation will be able to help you.
I think the great thing about your price too, that's it. You're going in possibly the rectum, vaginal canal for evaluation and treatment. And guess what? You can do this in the comfort of your own home. You can go to somebody's house, right?
Yeah, we go to your house. So that is, one thing that people don't feel comfortable talking about in the clinics, and that is something we realize that going to their home will help them feel more comfortable, and they can talk about it.
Right.
Yeah, that sounds great.
So the one thing I wanted to mention also, so when we were talking about, the meds or whatever, I briefly mentioned magnesium. Magnesium is a great natural muscle relaxer for like chronic tightness or spasm in there. That can help. Again, we're still talking about symptom management, though. You want to get to the root cause, but that's a non-invasive pill, so to speak, that you can take. And then are there any, like at the gym or exercises people can think about doing besides Kegels that may help?
So, if you are working out, you want to make sure that when you are doing any exertion, you breathe out and so that you're not creating a Valsalva maneuver and you're not putting a lot of pressure on your pelvic floor muscles. Also, there are good lifting techniques. Like if you're doing lifting, you want to make sure that you are activating your pelvic floor muscles and your transversus abdominis muscle before you lift, and you're breathing out at that time while you're contracting those muscles, and then you can let go. So those are the important tips that I would give if people are working out in the gym and doing lifting.
Right. And just so everybody knows, I've been in the gym, actually didn't see it happen, but actually taught the person where they were doing a heavy squat and prolapsed their rectum from that. I mean, that's crazy from the strain and the pressure that you're putting internally.
Absolutely. Yeah.
It's important to get good lifting technique.
Learn the right technique of doing those exercises. Yeah.
Right.
Yeah. In our core stabilization podcast, we talked a lot about using the transverse abdominis and that. So if anyone wants to go listen back to that, it has a lot of this similar information to branch off further with that. And I love the exhale with the exertion. That's what I tell all my like personal training clients. We're always exhaling with the exertion, exhale and exert at the same time.
Yeah.
Well,
people don't realize that, when they're doing it, they're holding their breath. Even like my patient, I would look at them like, you're holding your breath. Like, no, I'm not holding your breath. So you have to kind of train that. Yeah.
Anything else we should go over?
I think so. We're good.
Well, thank you so much, Fahir, for being on. I mean, my wife and I really want to go out with you and your husband at some point. I'm trying to set that up so I'm looking forward to that. I guess the way that people can get in contact with you is through your website, which is www.pp, P as in people, so pptaw.com, right?
Yes.
Okay.
Yeah. Thank you.
Any other way they can get in contact with you that I should tell them?
They can call on 336-929-1056, or they can also email, and that is on our website too. I have like our email address and the contact information on the website too. There's Facebook page, Instagram page of Personalized Physical Therapy and Wellness.
Right.
So,
and you guys don't need a referral from a medical doctor, right?
Yeah, you do not need North Carolina is a direct access state, so we do not need a referral to see patients. So you can just call us, and we will be able to reach to them within 72 hours.
And you guys, what's the insurance thing with you guys in the state? Do you take insurance or not?
We do not. So we do super bill.
Okay. It's kind of like what I do. You're
mainly cash based, but if they can submit to their insurance later on. Yeah.
Right. Yeah. Okay.
Yeah. Thank
Anything
you.
else? Yeah.
Thank you. Phenomenal education for me, and I'm super interested in your guys' business practices as well. So this is great for me. Thank you.
Thank you for having me. Yeah.
Thanks so much, Fahir. Give Savar my love, and hopefully we'll see you guys soon.
Yes. Yeah. Hopefully we'll meet.
Face to face.
Yeah, sure. Okay.
Take care.
Bye, everyone. We'll talk next week.